Back in April of 2022, I was diagnosed with leukemia cancer. So it's been over 4 years now that I've had the disease, and I'm going to talk about it in this video and some of the things that you can expect, and some of the things that were harder for me, and some of the things that weren't as hard as I thought they were. So I'm going to get into all that stuff and talk about my story in this video. So first off, how I found out that I had leukemia was actually because I was diagnosed with rheumatoid arthritis in 2020. And what was going on is I was getting all this joint pain, especially in my fingers and my feet. And I would go in and I would get these blood tests, and the blood tests would consistently show that my platelets were going up. It also showed that my white blood cells and red blood cells, things were happening with my blood, and it was getting worse with each blood draw I was doing. I think I was doing a blood draw maybe like once every 3 months or so. And so that's how I eventually came to discover that I have cancer, that I have leukemia, is my rheumatoid specialist recommended me to go to a hematologist. And interestingly enough, I called the hotline for the hematology, and it was actually the cancer clinic. And I was scared to death once I found out that this was the cancer clinic. And so I actually hung up the call, and I didn't message them or reach out for probably over a month or something, which I don't recommend doing that. But yeah, because I was just scared. I was like, nope, I am not going to do this if this is for cancer. But anyways, it's not like my blood results changed. They, like I said, kept getting worse. So eventually I reached out to the cancer clinic, scheduled an appointment. I got a bone marrow biopsy. So they took this big needle, stuck it straight into my bone and extracted some bone marrow and tested it. And I must say, that experience right there, that's a whole experience right there. But it wasn't as bad as some people think. They did sedate me for that process for the bone marrow biopsy. Yeah, I think they actually put me on fentanyl, of all things, which is pretty crazy. Anyways, I did the bone marrow biopsy and I got the test results back. And when I actually found out about this test, this is pretty crazy. I was just laying in bed in my bedroom, and I got a notification from MyChart. So I have MyChart. It's this site online where I can see all my medical information and my test results. And so I got a notification, oh, I have a new test result. So that was a test result from the bone marrow biopsy. It's one of those things where I know this is a big deal. So instead of waiting for my doctor's appointment to interpret the test results of the biopsy, I did what probably a lot of people do. And that is I just went online to MyChart, checked the result, and I saw that the result was positive. And then in that, it's my heart fell out of my chest, and I became extremely emotional and devastated when I saw that I had this diagnosis of chronic myeloid leukemia. And I just had these feelings of am I going to die? And I just had to in that moment, just let go of everything. It felt like nothing in the future mattered. I was what's the point of making plans? Am I going to die? And so that was extremely scary. And one of the times in my life I was closest to death in terms of my mental state, thinking, okay, what's going to happen here? So then I basically went to the doctor, pretty emotional here. And the doctor explained things, that I have chronic myeloid leukemia. And then I got set up with a chemotherapy treatment called dasatinib. So I take Sprycel, which is the brand name for that drug. And it's an oral pill that I now take every day, once a day. And something about that pill that is nice is that I don't lose my hair. I think that's one of the stereotypes of cancer, is people losing their hair on their body, but I don't lose any hair on my body. It's possible that my hair has possibly thinned because of that, but I don't know. I don't really notice much of a difference. And so I got on the dasatinib, and I must say the side effects were intense. Initially, just getting used to it in my body. so much fatigue. I had to take more naps than I was used to in the day. I also had just like random pain in my body. I remember there was a time I kneeled down on my knee and then just excruciating pain just on my knee. And I'm like, what's going on? I'm not even doing anything. I kneeled down on carpet, so that's why it didn't even make sense to me. So I'd get like just random pain all throughout my body. And so, yeah, so there was a ton of side effects, and I feel like that happened for months. I also was taking methotrexate to treat rheumatoid arthritis, but apparently I guess that could also be used to treat leukemia. And so I feel like there was a bunch of side effects between those two medications. I also took, I think, Resuvio, which is the injection form of methotrexate as well. Just tons of side effects. I was nauseous and feeling sick quite a bit. And there were times where I would throw up. It was horrible. It was horrible. So the first many months of that journey, just a really hard journey. But the good news is it started to get better. But I will say first, so I was doing something called a BCR-ABL. So that's kind of like the main test to see if I have cancer in my body. So I was doing a blood draw to do that test. And initially, the cancer in my body actually went up. So yes, the cancer actually went up in my body after the first couple months, because I think the chemotherapy, it might take a few months for it to finally take effect. But then after a couple months, my BCR-ABL tests for cancer started to go down. So I want that number to go down, and it actually did, which was a great blessing because then it showed that the medication was actually working. Now, initially, with my platelets going up before I got the bone marrow biopsy and saw the doctor, I think my platelets got up to above 1,500, which I discovered is kind of like an emergency, and you're really prone to having a stroke if you get in that range, maybe even above 1,000. So it was like mine were above 1,500. And that's what makes leukemia such a scary disease, is that, well, outside of my rheumatoid arthritis, I wasn't experiencing any kind of side effects at all. And so if not for the rheumatoid arthritis, it's possible that I could be dead today and not be here, which is extremely scary about this disease. Is someone could get tested and then they find out that they're already in the blast phase and they're in the final phase of the disease. And at that point, most people die. And so that's why I think, honestly, this is one of the scariest diseases. So now I'm going to tell you a story. I met this man, I want to say last December, and I was at Green Lake in Seattle, which is a great park. And I met him just kind of randomly there. And he was telling me about how he was going to do this bone marrow biopsy, and he was referred to go get tested for cancer and all of these things. And he hadn't done the bone marrow biopsy, and he had no idea what's going on. And so it was just interesting to see him pre-biopsy, and he wanted to talk to me about my biopsy because that got shared about my cancer experience and all these things. And so anyways, I didn't really get a chance to share with him, but I ended up seeing him like 2 or 3 months later. And when seeing him, he comes up to me, we have a conversation, and he immediately was like, I got the biopsy and I got the results. And he then told me that his results were, his doctors told him he only has about a year to live, and that they actually found some sort of mutation or something, and that he only has a year to live. And I just, like, my heart sank hearing that, because it's just like, wow, like, here's a man that I saw before the biopsy, looked like there was nothing wrong with him. I estimate he was probably in his 60s. And that's why, like, these biopsies can go either way. I look at that man and I just think, wow, like, just what a horrible diagnosis, and only given a year to live. And I haven't seen him since. I do think about him sometimes. I don't know what's going on with him. But I wanted to share that because, like I said, with leukemia, it's scary because you may not even know that you have the disease. Just a simple blood test even can show signs that could be incubating in your system. And oftentimes people don't get these blood tests. And so I just wanted to share that story about that man. But yeah, coming back to my journey here, in terms of being diagnosed with cancer and my experience of it. I'd say for me, yeah, there was all those side effects. Yeah, that was really hard to be with the chemo and everything. But I'll say for me, probably the hardest thing to be with was actually just telling people in my life. So, like telling my parents, telling my girlfriend, it just immediately brought emotion and tears. And it just felt so devastating. It was like every time I told someone new, it's like it brought back being diagnosed again for the first time. And even though I may process all I can about the diagnosis, when telling someone new, well, it's new for them. And people may have their thoughts and views of cancer. I think it's pretty safe to say that society has deemed cancer as one of the worst things that you could get as a diagnosis. And so I think when people hear that, it's hard for them. And I get it, no doubt. And so that was one of the hardest things, is just telling people that I have cancer. So actually, initially, after finding out, there was a lot of people I didn't tell for months. I really only told like my girlfriend and then my parents, and that was it for months. And then finally, after some months of processing this, I finally came out publicly. I have another YouTube channel with almost 65K followers. I shared about it on there. I shared about it with other relatives. Yeah, I feel like there's a freeing experience with being able to share it and just coming out and being transparent and just saying, "Hey, I got cancer," and just sharing about that process. And so there were some things that I noticed too about sharing. So most people were extremely gracious and generous and welcoming of my diagnosis. But another thing that I found, and this was maybe a side effect of sharing, is there was a very small population of people that would give unsolicited advice. And so I thought this was really interesting, as I would say, okay, I have leukemia. And then someone's like, oh, have you tried this special thing and done this special thing? And have you tried this special treatment and this and that? And it's very strange. It even happened once when I was selling a microphone, I think on Facebook Marketplace, and I was meeting this random man. On Facebook, you can like look at people's stuff. And so apparently this man looked at my profile and all this stuff and saw that I had cancer. And even him, he was like, oh, my sister tried this tonic or this special supplement thing, and she's now rid of cancer and all this stuff. So I just thought that was really weird. Like that there was sort of this group of people that would want to give unsolicited advice that I just wasn't even asking for. And I'm not really a fan of unsolicited advice when it comes to health problems and things like that. It's just not my cup of tea, okay? So that was something that I found that I just thought was really strange, because it's like I have this personal relationship that I've built with my cancer doctor, and that's my number one go-to is my cancer doctor. And I'll also put that out there too, is if you're starting this journey for the first time, if you happen to be watching this, the relationship that you build with your cancer doctor is going to be one of the more important relationships in your life. Okay? Let that really sink in, okay? Because for me, we're going to do a little full circle here. I'll come back to that part there. But for me, about 4 months ago, I did another bone marrow biopsy and I tested undetectable. Okay. Tested undetectable. Great news. Just blown away out of this world. Great news. So what that meant for me. So I had talked about this with my cancer doctor. I had to go 2 years of undetectable blood tests, and then I also had to test undetectable at the bone marrow biopsy level in order to even consider possibly ending my chemotherapy treatment, which I got there. I met those requirements. I also had I think a full molecular blood response where my blood levels all looked normal. It looked like I didn't even have cancer. It was undetectable. And so that was something that I was working with. And my cancer doctor tells me this news, and I am just elated Here I am, like crying, emotional, like, yes, this is what I had been hoping for. I had been on chemo for 4 years. So after that, I had to do blood tests every month. 2 months later, so this would have been about 2 months ago now, I do my blood test. I get a result in my chart. I go and check it out. Tested positive. Came back. I'm still processing that result. And yeah, tested positive. So where do I go from here? What's the next step? So I talked to my cancer doctor, and now I'm going to be on this chemotherapy treatment, dasatinib, indefinitely, the rest of my life. Unless there's some other life-saving treatment for leukemia, this is going to be my life path, which is taking dasatinib the rest of my life. And so I want to now circle back to the relationship with my cancer doctor, and why this is really important if you are taking this journey, and why you really want to make sure you get a good doctor that you trust, is that my cancer doctor, I've never had a doctor like this before. I don't think I've ever been as close to a doctor as I've been with my cancer doctor. I've had times where I get a phone call late in the evening on like a Friday, on like a Friday or something like that, right? And I'm like, this is weird. This is coming from like the hospital or whatever. I answer the call. It's my cancer doctor on the phone. It's like, doctors don't talk to patients like outside of appointments, like ever, right? But my cancer doctor would like sometimes just call me, and he's just like, hey, just want to let you know, like, you got an undetectable result. Your blood's looking really good. And just, I wanted to call you and let you know. And I was just like, wait, what? Like, you're actually calling me and having a conversation? And I was just absolutely blown away that there's doctors out there like that. It's not like he's getting paid to give me a call. And so, but I feel like that's happened multiple times. He'll just call me. And then there's the times too where he's been there when it's hard too. And I've had times where we're just talking about random stuff. Like the appointment's done. When I go see him and we just talk about random stuff, honestly, I feel like I could be the guy's buddy. Like, he is a really cool guy. And that's why it's like the relationship you have with your cancer doctor is going to be one of the most important relationships you have with a person ever. Okay. And that's why it's just really important. Because here's the thing too. I realized pretty soon after being with my cancer doctor that it doesn't even matter. Having a primary care doctor, I don't even see my primary care doctor ever. Maybe in the last like 4 years, I've only seen them maybe twice. But my cancer doctor has become essentially like my primary care doctor. Also, my rheumatoid specialist. Those two people have basically become my main doctors that I see. Like I said, I don't even really see my primary care doctor anymore. And one of the reasons why is because when it comes to the chemotherapy treatment, because it has so many side effects and interactions with drugs and things, every new treatment that I do that's a medication has to route through my cancer doctor because it's just so many interactions. So if I'm going to get on a new drug, I have to check with my cancer doctor first. Even if I go to an ER visit and they want to prescribe me something, I have to check with my cancer doctor first. Because there's just so many medications that interact with the chemo. There's in certain drug classes, there's like very few that I can have. So one is anti-inflammatories. It's a very common thing. You can even buy them over the counter, some of them. But there's only like one that I'm able to have in terms of prescription strength to treat my pain because it's the least likely to affect the stomach. And so that's why it's like, that relationship with my cancer doctor has been critical just to get the care that I need. And so that's something I learned in this process. Another thing I learned in this process is, wow, the stakes are way higher, even just going to an appointment and what they give me. So when I would go to the Fred Hutch, I go to Fred Hutch, Northwest Hospital in Seattle. When I would go there, and I've never seen this before when you go into a regular doctor's office, they give you a parking pass to cover your parking. They give you water. They give you snacks. They give you all this stuff. And I'm thinking, wow, I feel like I'm in first class when it comes to visiting the doctor, going to another doctor. Nobody does that. And so I thought, this is really strange that they're giving me all these special things, which was cool. That's really cool. Like I said, other doctors, nobody's giving me like bottled water and snacks or juice or whatever, right? But maybe it makes sense. If you're doing blood draws constantly, maybe you got to make sure you're hydrated and all these things. But that was another interesting part of all this. It's just the experience going to the doctor was way different than going to just a primary care provider. Now, in terms of other things that happened to me along my journey, I do want to say this. So after months of doing the dasatinib treatment, I finally was able to come off of methotrexate and only just use anti-inflammatories to treat the joint pain and the inflammation that I was getting in my body. What a blessing. My experience of being sick significantly reduced and life became significantly better. And so that was an observation that I made. And my body actually got used to the chemotherapy in my system. And this is so crazy how my body got used to this, because now 4+ years later on after being on this drug, like I don't feel like I'm foggy in my brain. My cognition is fine. I mean, you see me talking right now, everything is fine. And it's funny, when I got off of the medication, the chemo about 4 months ago, so you can apparently experience withdrawals if you're not on chemotherapy, if you've been taking it for years. So it's like my body got used to the poison of the chemotherapy. And honestly, I think I'm now better on it just because I've been on it for so long than off of it. And right now, life for the most part feels normal. And if there are side effects, they're really hard to see. The number one side effect, probably the hardest one to be with, is that I feel like it's really hard to heal from injuries. It's really hard to heal from things. So even just like a little cut that I got like a month and a half ago, I still see like a spot where I got that cut on my foot. And it's just like, it just takes so long to heal. Or like if I injure my ankle, which that's been the case where these injuries just don't go away. And so here's the worst thing. This might be too much information, but I had a really bad case of like skin tags, hemorrhoids down south, if you get what I'm saying there. And the pain was so excruciating, right? Well, I've dealt with these types of things for many years in my life, and I've gone in to the surgeon before, and they've done a procedure to help remove like an internal hemorrhoid thing. Well, yeah, there was a lot of pain then too, but over time, these things went away as my body healed. Well, here was the problem, and I think this was a result of the chemotherapy. I can't be entirely sure, but so over a year ago, excruciating pain when I was sitting, it was from the skin tags, hemorrhoids. Well, that didn't heal on its own. And I had that for a year. That pain, excruciating. I couldn't travel. I couldn't go beyond like a 30-minute drive from where I live. So I was kind of just stuck here for like at least a year, and just miserable pain if I'd sit, and miserable pain even when I was sleeping sometimes. And sometimes I just couldn't even sleep at night. And so that effect of not being able to heal, that's a horrible side effect. Like I said, I can't say whether or not that was completely involved. But yeah, so anyways, when I was able to get off of chemo 4 months ago, I was able to get a surgery down there to remove the skin tags because, and that's another side effect of being on chemo is you likely will have to get off of chemo in order to do the surgeries that you want to do. And so I had to get off of chemo in order to do that surgery down south. And why is that a problem? Well, because you think, okay, well, why not just get off of chemo? Well, here's the problem is when talking with my doctor about the possibility of coming off of chemo in the future, I had to be 2 years of undetectable tests, blood draw tests, all in a row. And so the fear is if I get off of chemo to do this surgery, then that breaks a chain. And then do I have to start a full fresh 2 years of being on chemo undetectable tests? And so that was the concern. So I opted not to do the surgery and I held off until I knew, okay, there's a chance that I could get off of chemo. And so that is one of the downfalls about being on chemo is in my situation, I would have had to get off chemo to do this surgery. And so, like I said, I decided against it and just kept going despite having all that pain. But I finally got to that point, like I said, where I could get off chemo, had the surgery, everything healed down there. Now I can finally sit, and it's so nice to sit. Yes, I went to the Oregon coast last 4th of July. Amazing experience. Probably like a 5-hour drive to get there, and I sat, and it was great. But yeah, so that's a downside is, for me, I notice it, is just struggling to heal from things. And so for me, I'm kind of more cautious in what I do, considering like the possibilities of getting injured or things happening. And so that's something I think about too, is it's just like, okay, if I get injured, it might be harder to heal. So I need to be careful. So that's something I think about. Another thing that's came up for me when I initially took the dasatinib, I was talked to by maybe the pharmacist or other people about the possibility of having children if I ever wanted to have kids. And it sounded like they didn't recommend me getting someone pregnant. I talk about that partly because, well, now if I'm on chemo indefinitely, and this is the rest of my life, I don't have kids. And I've thought about having kids before. And maybe that's something I have to grieve now, is the possibility that I may never have children. And so that's hard to be with. Now, is it possible I could get off the chemo and then get to a point where I could have a period of time where I could try to get my partner pregnant or have children? Maybe that's possible. I would need to talk about that with my doctor. But now that process gets a lot more complicated. And so that's also very concerning. Also, too, the chemo, as I understand it, is in my system, so it can come out in my waste. And so I have to be extra careful with contaminating other people. And so that was a concern too. So if I'm going to share the toilet with other people, I always have to put the lid down now, because apparently my pharmacist, I guess, was saying that even just having the lid up when you flush the toilet or something, things can get into the air. And so I definitely can't touch the chemo pills with my fingers and then go contaminate food or something with my fingers. Like I always have to wash my hands now, but I don't do that. I put the pill in the cap and then I take the pill that way. So I don't even have to wash my hands. But that's another thing about this medication, is it sounds like it can, since it's a poison, I could contaminate others. I don't know the consequences of what that looks like. And that's been hard for me to deal with, because I actually have OCD and I already have a fear around germs and also contaminating others. So that's been really hard for me, because I have these perfectionistic ways where I've dealt with that in the past around taking the chemotherapy treatment, like these rituals. Then I have to wash my hands and do all this weird stuff. And so that's actually been hard for me too. It's just the OCD that I have around taking the pill and then also going to the bathroom to make it so that I don't contaminate people. Now, I've done therapy in the past and did exposure therapy to help conquer some of the OCD that I had attached to taking this chemotherapy medication. And I must say that significantly helped. So that therapy was called ERP, which is exposure, response, and prevention. And that's just, kind of like a therapy that I can just do with a therapist. It doesn't involve medication. And I definitely would recommend that therapy, especially if people are struggling with obsessions and intrusive thoughts. Yeah, and that's not just around contamination, but anything involving the cancer experience. Just a really great therapy. And so I got a lot out of that. But yeah, overall, my cancer experience, I'm still learning as I go. I'm processing this second diagnosis. What's tricky about the first diagnosis is like, okay, this is horrible. I'm in this. Well, then I got used to it. Wasn't so bad, but I always had hope that, I can get undetectable, get off of treatment one day. I had that hope. Well, I went through that experience, got off treatment, found out I was positive after 2 months. So now I enter the second part of this cancer journey. And maybe this is the hardest part for me. And that is now I don't have that hope that I can get off the treatment. Like I said, this is a lifelong process now where I'm going to be likely taking this pill every day. And so I'm still in the middle of processing that. Now, as my doctor said, it sounds like people can live for decades on dasatinib. And especially if you catch the disease in the early phases, which I have. And so that's where I'm living right now. Now, am I like waking up in the mornings and like, oh man, I got cancer, life sucks and all this stuff? No, I don't really do that anymore. There's a period of time where it's like I accept I have this disease. And here's the thing. There's a gift about having cancer too. And some people may argue, well, there's no gifts about having cancer. It's a horrible disease. And I agree that it is. There's a gift too. Well, ever since I was diagnosed with cancer in 2022, it's now like in my foreview, I see death more. It's like it makes more sense to me that I'm going to die someday. Now, that may seem really morbid, depressing, but to me, I found it motivating because now that I have this cancer in my system and I see this death in the foreview, like now that I have cancer, it's maybe more likely I'm going to die. It makes me want to live. It makes me want to live more. Before this experience, I just was very unmotivated. Like it's kind of like I felt like the kid in college who waited for the last second to turn in the exam paper or the term paper, whatever. And now I kind of get that the ultimate deadline is death itself. And now being diagnosed with cancer, like I said, I see that ultimate deadline nearer in my future. And here's the thing is, it's possible I could live for decades more. I'm only 42 years old. And yeah, like I said, I could live for a long time in this situation. But like I said, the gift here is just being present to my impermanence, that I'm not going to be here forever. And now I can use the little time that I have left to really do what I want to do in life. And the gift of having cancer basically exposing me to that possibility of dying, I think is very inspirational. And I found it very motivating to do more things that I want in life. For instance, something I love doing is making videos. I've posted probably at least 50 videos in the last 9 months or so on various channels that I've done. And that's probably the most I've ever done in a 9-month period. And so, yeah, so I just want to say not all of the cancer experience is bad. And there are some good things too. I'd say too, sharing my cancer with people has also brought an opportunity to get deeper with some people. I feel like it also makes it more possible to forgive myself, forgive people, because I'm just thinking, none of this stuff matters. Why hold on to anything, grudges against people or family members or friends? It's like, have cancer and just let go, move on, right? And so it is a journey. And I've learned a lot on this journey. And some people I share this journey with, and some people I don't. Because I've learned kind of along the journey too that not everybody that I shared with, I realized, oh, maybe I didn't want to share with that person too. And something I've learned is I don't have to tell people that I have cancer. They don't have to know. And if I want to tell them, that's fine. But I don't have to. Yeah, so that's just another feature that I've learned along this journey too is it's my decision. Now, of course, like I said earlier, I told my family, told people important in my life. But also too, something else I learned is that it's actually really good to share with people about it because then it includes people in that vulnerable space with me and it gives people the opportunity to love me. So it is something that I would recommend sharing at some point if you're someone who was diagnosed with the people in your life at some point, because it just gives an opportunity for connection. But also too, I think part of me also thinks, okay, well, am I playing the cancer card here? And I just want to let that go, right? That idea that I don't, and I think this is why I waited so long to share my cancer experience, is I didn't want people to feel sorry for me. I didn't want to use it to try to get stuff from people, right? I didn't want to share that I had cancer and hope that now everybody loves me and feels sorry for me. That's actually the opposite of what I wanted. And I didn't really want that kind of attention. And so that's why I waited for many months before I came public and told more people in my life. Now, this video wasn't meant to be advice. I'm not here to give you advice if you have cancer or if you know people with cancer in your life. I just wanted to share my experience and what was useful for me, what I've learned about having cancer, sharing it with people. Yeah, I just wanted to share about my experience. And maybe I'll leave you with a story. So, years ago, I was at Green Lake in Seattle. I was just meeting random people. And this man comes up to me. And let me tell you, he looked miserable. He had no hair on his head. He looked like he had surgical things on his head. And he says, I have terminal brain cancer. And the doctor said I only have months to live. And he looked the part. He looked miserable. He looked like he was really struggling and looked like he was currently undergoing treatment himself. And we had that conversation, went our separate ways. Okay. Years later, I was at Green Lake. Once again, years later, having conversations, just trying to meet people. And then this man comes up to me and he says, do you remember me? And I said, no. And then he tells me, I'm the guy who had cancer, brain cancer, and that he survived. This was years later. And he looked like he had a full head of hair. This guy looked amazing. He looked like the happiest guy in the world. And so I'll leave you with that story because people who have terminal brain cancer like that, I'm talking about over 90, maybe even 95%. I don't even know. The majority of those people die, okay? But this guy didn't. And so not everybody dies. And so I just want to leave you with that story because I think about that and I think that's really inspiring, that story. But then also too, I think about my own journey and just how I want to focus on the positive. I don't have to always focus on the negative stuff. I don't have to always focus on, oh, my test result was positive again and, oh, how this is going in the chemo treatment. I don't have to talk about that with anybody. Or if I want to, I can. But for me, I have found it useful to focus on the positive. Do the things that I love. Here I am. I love making videos. I'm making videos. This helps me. I love this. And so I'll just leave you with that note. Yeah, leave you with that, the positive, and focus on the positive. And if you're watching this and you were just diagnosed or you know someone who was diagnosed, I truly wish you the best. Truly wish you the best on your journey. And please share about it in the comments below. I'd love to hear about your experience too.